Hi, my name is Taryn Rodriguez, and I will be present the exercise from Unit 4 to the chapters 24 to page 4. Now, point 1, chapter 34.1. Match the two parts of the sentence. Look at A, B, and C opposite to help you. Number 1, 1988 saw the UK launch of Live Attenuate. Letter J. Number 2 with the letter E. Number 3 with the letter A. Number 4 with the letter H. Number 5 with the letter B. Number 6 with the letter C. Number 7 with the letter F. Number 8 with the letter D. Number 9 with the letter G. Number 10 with the letter I. Point 2. Complete the case report on the patient in A opposite. Look A, B, and C opposite to help you. On examination, he looked unwell. His pulse rate was 100 per minute. He had a palpable spleen. The combination of fever and rigors in a patient who has recently returned from Africa strongly suggests a diagnosis of malaria. The incubation period is usually 10 to 14 days. In this case, the patient admitted that he had not been taking prophylaxis regularly. The diagnosis was confirmed by the presence of parasites in his blood film. Complete point 3. Complete the sentences. Look at A, B, and C opposite to help you. Number 1, an infection which can be treated successfully with antibiotics is curable. Another word from an epidemic is an outbreak. Bacteria and viruses are examples of microorganisms. Someone whose temperature is normal is afebrile. The common infection with Epstein-Barr virus is known as glandular fever. Chapter 25.1. Complete the table with words from A, C, D, and E opposite. Noun, affect. Adjective, affective. Noun, anxiety. Adjective, anxious. Noun, behavior. Adjective, behavioral. Noun, dementia. Adjective, demanded. Noun, disturbance. Adjective, disturbed. Noun, suicide. Adjective, suicidal. Point 2. Make word combinations using a word from each box. 2 words can be used twice. Okay. Behavioral syndrome, eating disorder, major depression, mental retardation, personality disorder, psychomotor retardation, sleep disturbance, substance abuse. Point 3. Complete the sentences. Look at A, C, D, and E opposite to help you. Number 1. The way a person behaves is his or her behavior. A persistent emotional state is a mood. A sudden attack of anxiety is a panic attack. The form of dementia associated with aging is called senile dementia. A disorder which is not associated with pathological change is functional. An idea which forces a patient to repeat unnecessary actions is a compulsion. Point 4. Which symptoms of depression was this patient suffering from? A 56-year-old woman presented to her GP complaining of increasing tiredness over the past few months. She had lost interest in most things. She was sleeping poorly and tended to wake up early, but denied any suicidal tendencies. She was thirsty and was passing urine more often. She was eating normally and her weight is steady. And the symptoms are fatigue or tiredness, loss of interest, and sleep disturbance. Okay, next, chapter 26.1. Complete the table with words from A, B, and C opposite. Adjective, blind. Noun, blindness. Adjective, conscious. Noun, consciousness. Adjective, deep. Noun, deafness. Dizzy, dizziness. Numb, numb, numbness. And light-headed, lightheadedness. Unsteady, unsteadiness. Make word combinations using a word from each box. Double vision, epileptic fit. Prodromal symptom, syncopal attack, urinary incontinence, visual activity. Visual acuity. A doctor is trying to determine the cause of loss of consciousness in a 52-year-old man. Complete the doctor's questions. Did you lose consciousness suddenly or gradually? Did you get a warning of the attack? What were you doing before you passed out? Were you worried or under any stress at the time? Did you feel dizzy or lightheaded before the attack? Did you lose control of your bladder? Did your wife notice any involuntary movements while you were unconscious? Okay. The next chapter, 27.1. Complete the table with words from A and B. Noun, absence. Objective, absent. Diminution, diminished. Flaccidity, flaccid. Spastic. Wasting, wasted. Point 2. A doctor is giving instructions to a patient during examination of the motor system. Identify what the doctor is assessing in each case. Number 1. I'd like you to relax. I'm just going to move your arm up and down. Muscle down. Can I see your hands? Muscle ball and possibly involuntary movements. Now, I'm going to straighten your arm out. Try to stop me. A power. Can you touch my finger with yours and then touch your nose? Good. Now, do it again with your eyes closed. Coordination. Point 3. Complete the sentence. Point number 1. A flaccid hand drops limply to form a right angle with the wrist. 2. Brisk reflexes are reflexes that are stronger than normal. Muscle wasting means the muscle is reduced in bulk. A tic is a form of involuntary movement. A K is often used to test the Babinski response. His coordination was poor. He could not perform rapid alternating movements. A reflex hammer is used to test reflexes. When something is diminished, it is less than normal. A patient is brought to A&E in coma. When her name is spoken, she opens her eyes, but she does not answer questions or obey instructions. What is her GCES score? Eye opening to speech, 3. Verbal response, known, 1. Motor response, known, 1. So, the next chapter is 28. Point 1. Complete the table with words from A, B, and C opposite. Verb, cure. Verb, cure. Noun, cure. Adjective, curative. Excise, excision. Grow, growth, growing. Invade, invasion, invasive. Abstract, abstraction, obstructive. Palliate, palliate, palliation, palliative. Palpate, palpation, palpable. Spread, spread, spreading. Swell, swelling, swollen, or swelling too. Point 2. The notes below are about the patient described in the opposite. Use them to put the sentence 1 to 9 in the correct order. To make the next paragraph of the case report. Okay. Number 6 is the first. So is on examination, his temperature was 37.8 Celsius. Great. There was a smooth, firm 4 centimeters mass in the right supraclavicular fossa. There were enlarged lymph nodes in both axillary and inguinal areas. His mouth and throat were normal. His pulse rate was 100 per minute regular and blood pressure is 112 per 66. His cardiovascular and respiratory systems were normal. On abdominal examination, there was a mass palpable 3 centimeters below the left costal margin. Examination of the central nervous system was normal. Complete the sentence. 1. Distant spread or tumor cells is known as metastasis. 2. Many symptoms of cancer, such as difficulty swallowing, are due to obstruction. 3. The opposite of painful is painless. A malignant neoplasm is called a cancer. Tumors which do not invade or metastasize are benign. Secondary tumors are those which result from the spread of a primary. If a cure is not possible, palliative treatment should be given. A palpable liver suggests metastasis. Now I continue with the chapter 29.1. Complete the sentence. 1. A baby that is born a week before the EDD is premature. A termination of pregnancy may be necessary for medical reasons. The first 3 months of pregnancy are known as the first trimester. Fetal distress in the first stage of labor is an indication for cesarean section. This was a breech presentation and delivery was by forceps. A miscarriage is another term from a spontaneous abortion. The cord was wound tightly around the baby's neck and it was unfortunately stillborn. Complete the table with words from A opposite. Verb, abort. Noun, abortion. Deliver, delivery. Induce, induction. Miscarry, miscarriage. Present, presentation. Terminate, termination. Dr. Bennett and Shaw is presenting a patient at a weekly meeting in the obstetric unit of a hospital. Complete the presentation with the correct form. This is Clara Davis. She came to the antenatal clinic at 9 weeks. In her past obstetric history, she had a pregnancy when she was 18, which was terminated, and another 1 year later, which spontaneously aborted. Since then, she has had 3 pregnancies. In the first, the baby was delivered normally at 40 weeks. In the second, she had an induction of labor at 39 weeks because of fetal distress. The third baby presented as a breech and was delivered by cesarean section. Now chapter 30.1. Make word combinations using words from each box. Blood stained, breath sounds, pleural rubs, predictive cough, vocal resonance. Point 2. Rewrite the questions using words that are better known to patients. Okay, number 1. Is your cough productive? Do you cough up any phlegm? Number 2. What color is the sputum? What color is the phlegm? Number 3. It is ever purulent? It is ever yellow? Number 4. Have you ever had hemoptysis? Have you noticed blood in it? Number 5. Do you suffer from dyspnea? Any problems with your breathing? Point 3. Are the following statements true or false? Are the following statements true or false? Give me reasons for your answer using your medical knowledge. Number 1. A patient who has a loose cough produces phlegm. That's true. A productive cough is often described as loose. A cough may be productive where the patient cough up sputum or phlegm. Number 2. Crackles are heard when the airways are narrower. That's false. Crackles suggest the presence of fluid in the lungs. Number 3. A patient who has a non-productive cough produces sputum. False. A cough may be non-productive where there is no sputum. Number 4. Wheezes are typical of pleurisy. Yeah, that's false. 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 Wheezes indicate narrowing of the airways. The sound of an asthma patient's breathing is also called wheezing. Number 5. A pleural rub is a sign of asthma. That is false. Again, the sound heard when the pleural surface are inflamed, as in pleurisy, is called a pleural rub. Now let's continue with the chapter 31.1. Oh, 31 no, sorry, 31 no, because I presented this. 32. Okay, let's continue with 32. Write the corresponding medical terms for the ordinary English words and say what kind of force is involved. Common word, bruise. Medical term, contusion or hematoma. Type of force, blunt. Common word, cut. Medical term, incisive wound. Type of force, sharp. Raise, abrasion, blunt. Scratch, linear abrasion, blunt. Stab wound is a penetrating wound, sharp. Tear, laceration, blunt. Point 2. Choose the correct words to complete the description on the injuries shown in the illustration. There are grazes above the left eyebrow and on the left side of the neck. A contusion to the left side of the lower lip and tears to the left cheek. Write a description of the injuries shown in the illustration. There is a laceration on the left shoulder and an incised wound approximately 6 centimeters in length above the left nipple. Point 4. Complete the sentences. Look at A, B, and C opposite to help you. Number 1. Frequent chance of position are necessary in the immobile patient to prevent the development of a pressure shock. Number 2, he had several stabs, once in the abdomen from the knife. He was knocked unconscious by a heavy blow on the head. Number 4, the wounds were only superficial and required no treatment. Chapter 33.1. Look at conversation in A opposite and complete the notes about Mr. Jones. CO frequency and nocturia for 1 year. No dysuria or hesitancy. Flow a little weaker. No incontinence apart from occasional dribbling. Point 2. Match the patient's descriptions of their symptoms. I have to pee every half hour or so. Letter B. I get a scalding pain when I pass water. Letter A. I have to get up several times to pass water at night. Letter E. I have to rush to go to the toilet. Letter F. I have trouble getting started. Letter D. I can't hold my water. Letter G. I passed some blood in my urine. Letter C. Point 3. Write the doctor's questions for each of the symptoms. In 33.2 above. Okay, this is in the back here. Possible questions. Frequency. How often do you pass urine? Dysuria. Do you get any burning or pain when you pass your water? Nocturia. Do you have to get up at night? Hesitancy. Do you have any trouble getting started? Incontinence. Do you ever lose control of your bladder? Hematuria. Have you ever passed blood in the urine? Urgency. Do you have to rush or hurry to get to the toilet in time? Point 4. Describe the findings of the laboratory report in words. There was a trace of blood, gross proteinuria, and no cast. Finally, chapter 34.1. A doctor is talking to a patient during an ophthalmoscopy. Match the underlying expressions she used to expressions with similar meanings from A opposite. Okay. So, number 1, a topical mydriatric solution. Number 2, to aid dilatation. Number 3, the examination is done with dimmed lights. And number 4, fixate on a target. Now, point 2. Complete the instructions. Wrap the cuff around the patient's upper arm. Number 2, place the diaphragm over the area of the brachial artery. Raise the patient's arm so that the brachial artery is at the same height as the heart. Number 3, close the valve on the pump. Number 4, pump up the pressure to at least 150 mmHg. Open the valve a little and slowly deflate the cuff while listening and watching the pressure gauge. Number 5. The first sound you heard is the flow of the blood through the brachial artery. The valve on the gauge at that point is the systolic blood pressure. Number 6. Continue listening while you slowly deflate the cuff. Number 7. The diastolic blood pressure is measured when the sound completely disappears. Point 3. Complete the text. Phlebotomists are specially trained in taking blood. They are skilled at venipuncture, puncturing the vein to take a blood sample. The wrist, hand, and foot can be used much more often. A vein in the inner part of the elbow is used. If it is difficult to locate a susceptible vein, the patient may be asked to make a fist or a tourniquet, may be applied on the upper arm to make the vein more apparent. Afterwards, a dressing is applied and the patient is asked to press gently. This helps to stop the bleeding and prevent bruising at the site. It is important that specimen tubes are labeled correctly before they are sent to the hematology laboratory, where a full blood count or other investigations will be carried out. Thank you so much. See you then.